Hello, my name is Javier Alejandro and I talk about diabetes. Diabetes is a disease that occurs when the level of glucose in the blood, also known as blood sugar, is too high. Glucose in the blood is the main source of energy and comes from food. Insulin, a hormone produced by the pancreas, helps glucose from food enter cells to be used for energy. And sometimes the body does not make engine or not insulin or does not use it properly, and glucose stays in the blood and does not reach the cells. Over time, excess glucose in the blood can cause health problems. Although there is no cure for diabetes, a person with a diabetes can take steps to control their disease and stay healthy. And sometimes people with diabetes say that they have a little high blood sugar or they have a
Type 1
pre-diabetes.
diabetes, you're gonna need to take mostly like one dose daily of insulin because your blood produces little to no levels of insulin. Type 2 diabetes, your body doesn't use correctly the insulin that it produces. So like most treatments are like a healthy diet and a healthy lifestyle, like doing exercise and eating healthy. But at some point you're gonna need to take oral drugs or take insulin shots. Gestational diabetes. The gestational diabetes consists on a high blood glucose levels. It usually disappears when the mom gives birth, but usually leaves their children with a higher chance of having diabetes type 2. I'm gonna talk about all types of diabetes that exist. First one, we have the type 1, which occurs most frequently on children and teenagers. We have the type 2, which is the most common one, because it takes the 90% of all diabetes cases, and these usually develop in older ages. And we have the gestational diabetes, which is the one that happens during pregnancy.
It is due either to the fact that the production of insulin it is not sufficient of the needs, or because its effectiveness it reduces. It is believed that the cause of the types diabetes is related to factors associated with the lifestyle of developed countries, since it is more common among the overweight people or among those who do not practice physical exercise. The causes of diabetes are multiple and vary depending on what type it is. Among the most frequent we find overweighting or obesity. Being overweighting can lead to insulin resistance, which is why people who suffer from it are at greater risk of being affected by type 2 of diabetes. Lack of physical activity. Sedentary lifestyle contributes to weight gain that excessive levels causes overweighting and obesity. Also important to consider where the body fat accumulates. The presence of fat in the belly can cause insulin resistance, as well as cardiovascular diseases.
A new complication-centric model identifies 4 distinct evidence-based disease stages along the type 2 diabetes spectrum, emphasizing preventive care that begins at the first signs of insulin resistance. The model, labeled by statement authors as dyslipidemia-based chronic disease, or DBCD, includes recommendations for comprehensive risk reduction strategies, including lifestyle, changes and weight loss therapy to mitigate the progression to diabetes or limit the effect of stabilizing type 2 diabetes. The position statement identifies 4 stages of dyslipidemia-based chronic disease. Stage 1 defined as DCVD insulin resistance. Stage 2 defined as DCVD prediabetes. Stage 3 defined as DCVD type 2 diabetes, and Stage 4 defined as DCVD vascular complications, including retinopathy, nephropathy, or neuropathy, and related microvascular events.
Hello, my name is Luis Jesus Perez Gonzalez. I'm here to introduce to how can I to prevent or delay the onset diabetes type 2. If you are at risk developing diabetes type 2, you may be able to avoid or delay it. Most of the things you need to modify lifestyle. If you make changes, you will also health benefits. You can lower of physical diseases and your problem feel better and more energy. The changes are lose weight and keep it off. Weight control is important part of diabetes type 2 prevention. You may be able to prevent or delay diabetes. For example, if you losing 10 or 20 pounds, if you have 200 pounds, is most important. As a conclusion, we can reach that is important, very important, the changes diet from a children, because if they will take care of, have the grow up, the children, the changes, the different mentality about the food. And this is presentation, and thank you so much.